Hi, I'm Kirk Phillips, and I'm a COVID survivor. I happen to teach in the College of Public Health at the University of Iowa, and I never thought that I would be on this side of the equation. I spent about a month in the hospital with COVID, so I guess I'm considered a severe case. And in this video, I'll talk a bit about my exposure, my treatment, and my outcomes of this disease. Novel coronavirus is a relatively new and unpredictable disease. It may affect the neurological system, respiratory, or cardiovascular systems. And I would say most every COVID patient has a different experience. So again, be careful about generalizing what I'm about to tell you. My path will likely be very different than others may experience with this disease. To illustrate that point, let me talk a little bit about my exposure again, my treatment and outcomes. This is my 99-year-old mother-in-law who lives in her home, cared for by her two daughters, myself, and professional caregivers that come into the home. As it happens, one of the caregivers acquired the disease from another patient. We did some fairly detailed contact tracing and brought it into my mother-in-law's household. My wife and her sister and my mother-in-law experienced mild symptoms that resolved in less than a week. And I experienced severe symptoms with about a month-long hospitalization. So here's my journey. Keep in mind again that each day that I experienced this, I really didn't know what tomorrow would bring. I would ask frequently about what are all these wires? What are you monitoring for? What are these treatments? What is the likely outcome of these treatments? And more often than not, they would not know the outcome. Clearly, they knew the treatments. Clearly, they knew what they were monitoring, my heart, my blood, etc. And they were very patient in explaining those things to me. But these mysteries about what might happen here, how will this evolve? Will it get worse? Will it get better? Those questions were constantly on my mind. On October 1st, we learned of the positive case that a caretaker had, and so we all got tested. On October 4th, we were negative, and the 1st, of course, we were negative. But on October 7th, I was found positive. Actually, the three of us were. My wife, sister-in-law, and mother-in-law were found positive at about that time. My initial COVID symptoms included an elevated temperature and rigors, hand tremors that I couldn't get my key in the door or I couldn't drink a cup of coffee. I also had cough and some fatigue. Then my symptoms began to worsen, and we made arrangements for a telemed appointment with the university hospitals. On this slide, the pink space is I was hospitalized. The blue space is caring from home, self-care. So on about October 14th, my fever continued to elevate. SpO2, oxygen saturation, was declining. Getting below 90 was starting to get to a dangerous level. So we visited an outpatient COVID clinic at university hospitals, and pretty quickly they transported me by ambulance to the hospital, to the ER to be admitted. I was transferred pretty quickly from ER into the medical intensive care unit, and you'll see on the remaining dates of these slides that I was bounced back to a rescue unit, a respiratory care unit, back and forth to medical intensive care and to the rescue unit. On November 11th, I was discharged, but pretty quickly had respiratory distress, and after about 5 hours at home, had to be brought back to the emergency room and returned to the medical intensive care unit and the rescue unit. So on about November 13th, I was discharged to home, recommended with 6 to 10 liters of home treatment and other medicines and so forth for my care. Part of the challenges with this experience were that the unknowns. In my life, I've always believed that the lack of information about something tends to create some anxiety in where I'm going or what I'm attempting to do. And in this case, the outcomes of my treatment were less known, again, as a function of the COVID disease. I was treated with high-flow oxygen with an OptiFlow nasal device shown on this slide, and given some experimental treatments, IVIG, intravenous immunoglobulin, remdesivir, IV steroids. I was monitored constantly, so I had heart leads as well as blood draws daily, respiratory chest x-rays, CAT scans, continuous saturation monitoring of my oxygen, as well as neurological tests. I was constantly asking questions, as I mentioned, of the staff, and they were very kind to answer what they knew, and also responsible in answering what they didn't know, which in an odd way was comforting. When you don't know where this is going, at least to be candid was comforting. Some treatments were experimental. I think the high doses of prednisone, about 60 milligrams per day, was at one point longer weeks or months on high doses of prednisone was also kind of an experimental approach to this. Let's see. I proned a lot, lying on my stomach, which was tricky because I was wearing heart leads and a catheter and other things. So moving about was kind of difficult, but I was self-proning. Oftentimes the staff would come in because my leads would fall off and they'd put them on my back. And they taught me how to breathe. I called it breathing like a guppy. So breathing in through your nose, holding it, and breathing out through your mouth was critical. While proning and while in the hospital during probably my toughest days, they shared with me that they were giving me oxygen at the highest possible level, and that if I wasn't able to keep my SATs, my oxygen saturation, above 90 or so, they would have to put me on a ventilator and intubate me. So I didn't sleep a lot, mostly breathing like a guppy through the day and through the night, again, trying to get my body to absorb as much oxygen as possible. And I was successful in that. I just stayed on this high-flow nasal device as well as a CPAP device shown in this slide, which is like a fire hose of oxygen. It just expands my lungs, allows me to exhale, but also pressurizes my lungs and pushes as much oxygen as possible into my system. It felt like strangers in strange places. This was a foreign experience, fortunately, but very quickly the skills of the staff and their willingness to explain what they knew to me and their very competent care was comforting. All the hoses, the inability to move about, the inability to go to the bathroom or shower and do normal hygiene was challenging, but they helped me through it. I have to say that healing is a lot of work. They gave me an incentive spirometer, this little plastic device that I regularly used. I have seen patients that choose not to use them, or maybe not to get up and walk. There's a certain resistance. It's not comfortable. But rest alone will not heal a person. So the staff engaged me in my care and really encouraged me to use the spirometer. Also encouraged me when sitting up, which was also sometimes not comfortable, to exercise, to do certain lifts, resistance bands, and so forth. Get up and walk. Not easy, but very important. They cared for me with nutrition. As I mentioned, I lost about 40 pounds. They suggested high protein food, gave me options of what I could order for each meal, and certainly to eat all my food was also a challenge. So I suggest here that healing is work, and to engage with providers is critical, because it sounds cliche, but it really is a team effort. And I'm sort of the main subject in this team, so I'm thankful for their advice and glad that I was able to follow it. So it's kind of a partnership thing. This is a picture of my wife who came daily. She happens to be a nurse with 20 and more years of critical care experience, and was excellent in caring for me and continuing to love and to pray for me. She brought oximeters into our home before all of this began. She bought oximeters for all of the households in our families and taught them what to watch for by way of signs and symptoms. She observed, understood, and asked questions with the providers. They were patient as they might come in on rounds, and I would say, I'd like to get my wife on the phone. And they were willing to pause, and we had conference calls. We didn't have Zoom calls, okay? But we had conference calls daily with my wife, who might not have been in the hospital at the time or might not be visiting. So I do think it's critical to allow family engagement. In this case, where my wife is very knowledgeable, but also she arranged for many people she informed many people about my status, who also cared and prayed for my healing. Again, I'm very thankful for that. So we're a fairly religious family, and we have this little shrine for our PPEs, personal protective equipment, little mask here on, I think that's St. Anthony, my bike helmet, of course. So my wife became my primary caretaker at home after discharge, and she arranged for high volumes of oxygen to be delivered to the home, a couple concentrators, each being able to deliver up to 20 liters, as well as tanks. And some of the outcomes include, after continuing with physical therapy and respiratory therapy, I no longer need oxygen, as you can see, during my normal levels of activity. But I do wear a concentrator on my back, which delivers, I think, up to 3 or 4 liters of oxygen. I'm back to bicycling with an oxygen device, a concentrator on my back, and a nasal cannula. And back to work, helping my son, for example, our son, break out a concrete pad where he's building a deck and so forth. So I'm attending therapy, respiratory therapy, 3 times a week. I do wear oxygen, 4 liters of oxygen during those therapy sessions, which include an hour of exercise on a treadmill, on a new step device, such as like a recumbent bicycle, resistance exercises, and so forth. My respiratory physician had noted that my healing was aided greatly by the fact that I never have smoked, that I was maintaining reasonable physical shape. I'm in my 60s, by bicycling regularly, exercising regularly before the episode, and now returning to many of those functions. These are scans of my lungs. On the right side, the scan was taken at about November 15th, when this episode was really at its worst. lungs need on these images, black space. So all this white netting and scarring and inflammation was present, and there was a comment made that I might have at this time about 40% scarring of my lungs, which raised fear that if only 40% of my lungs would function, that my health status and my life would be severely limited. As it turned out, I was given high doses of prednisone at this time, which we believe led to some clearing of the lungs. This scan is about January 15th, I believe. And after the high doses of prednisone, there is much more black space and less inflammation and more ability to breathe and absorb oxygen, as you can see. I continue to be followed up regularly with pulmonary function tests and CAT scans to monitor my condition. So I'm forever grateful. My health status has improved. It's not perfect. I continue to struggle with some numbness and COVID toes, we're calling it. Numbness in my toes, numbness in my fingers, some breathing challenges. But forever thankful to the caretakers of my wife and all those who cared and prayed for my healing. So I welcome you to get in touch with me if you have any questions about my experience with this. I wish you well. Stay safe. Prevent the spread of this disease, of course, with all of the masking, social distancing, sanitizing your space and your hands and your homes. And I wish you well. Thanks for listening.